Hey guys, it's Dr. Hub. Whether you're in medicine, from specialty to super specialty, allied sciences, or simply curious, this focus content it delivers the key points you need to know. Now we'll be continuing the physiological changes in case of the aging. So we covered the general changes of skin, skeletal bone, and the synovial and the CNS. Now we are going to look at the CVS. So CVS means the cardiovascular system. So here the arterial distendability and next will cause a decrease in arterial compliance. Next there will be increase in SBP, there's decrease in DBP, increase in pulse pressure, then there is decrease in arterial compliance, then ultimately there is increase in afterload. So to recap, we saw in CVS there is arterial distendability, there will be decrease in the arterial compliance as well as increase in the SBP and the decrease in DBP. The pulse pressure will increase and there will be a decrease in the arterial compliance, which leads to the increase in the afterload. Next, moving on to the EDV. The EDV, there is no change, and thus the preload is not affected. So preload is not affected. Then comes the blunting of the baroreceptor. Blunting of baroreceptor reflex. So under this there is a postural hypertension which is seen. Then moving on to the respiratory system, there will be decrease in strength, endurance. These are the respiratory muscles, and this is due to atrophy, and that is decrease in both static and forced expiratory volume. Next, there is also small airways. So the small airways, it tends to collapse. This is due to the degeneration of the collagen and also the elastin. Next, moving on to the exercise. This exercise, there is decrease in the VO max. Then looking at the renals, there will be decrease in GFR. There is linearly with age. Next will be decrease in clearance. So when you look at renals, there is decrease in GFR. This is linear with age. Linear. Next will be the decrease in the clearance. There will be decrease in capacity as well as compliance. This is the bladder. Next, there is prostate enlargement. So to recap, in renals we saw this decrease in GFR, that is, it is linear with age. There is decrease in clearance, there is decrease in capacity as well as the compliance of the bladder, and there is prostate enlargement. Next we'll look at the GI tract. So under this GI tract there will be increase in the exocrine, gland secretion, So there will be gastric acidity which is seen, and there is also a decrease in the colonic motility. Lastly, moving on to the endocrine. So to recap the GIT, there is increase in exocrine gland section, there is gastric acidity, as well as there is decrease in colonic motility. Now moving on with the endocrines, it includes, there is a decrease in the IGF-1, there is DHEA, there is TSH, decrease in IGF-1, DHEA, TSH, there will be increase in PTH, as well as menopause and terms of menopause, as well as andropause.